So good night, Tewksbury. It is Thursday, September 16th, 2021. The time is 6:03 p.m. I'd like to call this meeting of the Tewksbury Board of Health to order. We have 4 members that are present here tonight. We have a 5th that's dialing in or will be dialing in shortly. So we will have a full quorum present tonight. On the agenda, first I'd like to cover our approval of minutes. We have 2 sets of minutes. First is from August 18th, 2021, special meeting minutes, and we'll take that one separately. And then we have one from our last normal meeting on August 19th, 2021. So the clerk and I have both reviewed the minutes, and was Dr. Bichetti going to dial back in?
I just texted him back. So.
Okay. So the only question I have for the board, and Maria Zaroulis had it as well, is that we made one motion at that meeting on, actually 2 motions. I don't count the meeting adjournment as a actual motion. We had a motion to take a poll of the board on the preference of whether children start the school with the mask or not. You would put forth the motion, Mr. Scarano. I think in all the confusion having Dr. Bichetti in line, I did not hear anyone second the motion. And Maria, when we listened to the tape, it was hard to hear. So I'm not even sure if Dr. Bichetti had seconded the motion, if we just overlooked that. So I don't know if either of you two have any recollection.
I don't have my notes with me, but I do have notes from that evening. So I would have to retrieve my notes, but I generally mark down the motions that I proposed as well as the second and who seconded them. But I do not have them with me this evening.
Okay. And now as you do that too, but I did not do it for that meeting. So, I mean, the vote still stands. I just procedure want to make sure we have the record straight.
No, it makes sense to correct the record.
Right.
And maybe we should table the approval of minutes until we've corrected the record and we can check our notes. And
Yeah.
I don't think there's any imperative that the minutes be approved this evening.
No, I agree with that. I'd rather they be approved once we know that they're as accurate as can be. Okay, so we will defer those to the next meeting. And then we had the minutes for the meeting of August 19th, 2021, and I think in speaking with you, Mr. Scarano, you had indicated that...
Hello?
Dr. Bichetti?
Hello? Yep.
Can you hear us? Okay.
You're on.
I can hear you now. Yeah, I was locked in for about 15 minutes and then no one picked up on it, so I don't know what happened, but I'm here.
Okay. So we, in the interim, we just went over the August 18th minutes of the special meeting, and because we were not sure, and actually I'll ask you now, both myself and Maria Zaroulis were not sure if anyone had seconded the motion, and listening to the YouTube video, it was hard to discern whether someone had. And I don't know if you recall, if you may have seconded that motion, and Mr. Scarano is going to check his record, so we're looking at approving these minutes until the next meeting, just so we could check our records. The vote will still stand, but I just wasn't sure if you had any recollection yourself.
No, I don't. I think it's good for us to wait on it. I think we need time to review everything.
Okay. And then we were just starting to talk about the minutes from our regular meeting on August 19th, and I know talking to Mr. Scarano in advance of the meeting, he was thinking it would be good to defer voting on these until next meeting as well. So I don't know if you have anything else to add to that, Mr. Scarano?
I have nothing.
No, I agree.
I just renew it as a second motion for August 19th, that we table that until the next regularly scheduled meeting.
Okay.
I'll second that.
Okay, so motion's been put forth and seconded, and we're all duly noting this.
I'll make a note of that myself.
Okay, so motion's been put forth by Mr. Scarano and seconded by Mr. Rue that we'll table voting on approving the minutes from August 18th, 2021 and August 19th, 2021 until at least the next meeting. All those in favor signify by stating aye.
Aye.
And on the phone?
Aye.
Okay, chair votes aye as
Aye.
well, so that carries 5-0. New business, body art apprentice. I think it was before the last meeting, there had been an apprentice applicant that had applied for Route 38 tattoo, and Dr. Bichetti had offered to conduct a visual inspection and just sort of meet and greet with the person instead of having them come before us at a Board of Health meeting. And it really got us thinking, the whole reason that we had implemented that was when the Quincy Health Department discontinued their skin course for body art practitioners, that we had a slew of applicants that were getting training from all over the place, and we had no way of really properly establishing whether that training was on par with what the health nurse in Quincy was delivering or subpar. So we would have those both practitioner and apprentice applicants come before the board, and then our board quiz member, Dr. Bichetti, would quiz the applicant on some basic knowledge of personal hygiene and skincare preparation as it relates to tattoo applications. However, Route 38 Tattoo, for the last period of time, has engaged a training company out of New Hampshire called Wallace Training Consultants, who handle their CPR and the first aid and the bloodborne pathogen training that's required. But they've also been engaging him for skincare, and I think at the last meeting we saw that he had also created a aftercare training session as well. So not just watching how the tattoo's done, but also sort of the care afterwards. And I think, Dr. Bichetti, I'll leave this more up to you, but I think the rest of the board, and I'm just speaking for myself, my impression is that we all felt that Wallace training was suitable equivalent to what the Quincy skin course had been, and we were really questioning among ourselves the need to continue this requirement to have the applicant, whether practitioner or apprentice, come before the board so we could quiz them on their knowledge if they're getting training from a reputable place. So looking
Correct.
at discontinuing that and sort of making a motion to allow the director to have the administrative approval to approve those applicants if they are going through the Wallace skin training or the Wallace training that's being offered. And then just, no one's really else has come in, and we'll just handle those on a case by case. So I'll turn it over to you, Dr. Bichetti, but that's what we had been thinking of, and I think you're in line with that?
I am correct. That's fine. Yes, it's a comparable program to the Quincy. Mike does a good job of training his students, and I think that we've had good success. We've had a precedent for the past few years with that program, so I'm comfortable with allowing the director, based on the criteria you just mentioned that we discussed, it's acceptable to continue to have Wallace as a alternative to the Quincy program. Should things change down the road, then we have to go back and revisit. But as it stands now, what we've got in place with Wallace, it's fine.
Okay, good. So any questions or comments from board members here?
The only question I have is, does Wallace report directly to the director with a roster of people who have completed their course? Is there some follow-up from Wallace directly to the town about who has taken and passed their courses.
I honestly, and I don't know if you know, Dr. Boucher, but my impression is that while the training is done at the Route 38 location, I think that it's more sort of just-in-time training for the new person. I seem to remember Mr. Arsenal
Correct.
talking about that he would also look at using Wallace to come in annually or whatever needed to do refreshers for everybody. So he is issuing
Correct. Mike-
certificates of completion to the student.
So
He provides a certificate. He has given us, and then I remember passing on to Susan, the former director, information on the course. I was hoping to personally meet with him, but our schedules have not been able to coincide. But I looked at what Mike was going over on the course, and it's definitely the equivalent, and in many cases, additional information above the Quincy course, excuse me. So usually he'll go provide the trainings. He has certificates. He has a record of the people he's trained. I think that would be something that would be in addition. I'm comfortable with once he gets the certificate, he trains other people, but once someone shows they passed the Wallace training with the certificate he provides, I would say that would be sufficient, but that's a good thing. Member Scarano had mentioned, regardless, or if we want to keep track, we can maybe ask him to, once he's done training, he can additionally let us know. There's always a chance someone can get a counterfeit training. I don't feel that would be the case based on at least the relationships we have with the two studios that we've had proven success with and proven that's Route 38 Tattoo and Lucid Arts. But that's something we could consider asking if the other members feel fine. I'm happy with the certificate, just as we were with Quincy course. But if that's something we'd like to add to it, I'm okay with it.
Yeah, I think the other part is that no matter what town or city an apprentice or a practitioner may opt to move to, if they decide not to stay at Route 38, they're going to need to show training certificates anyway. So I think the employee is going to prefer to have a certificate so that they can keep a copy with them in case they do happen to move locations. And I don't think that when...
And technically they need yearly bloodborne pathogen training as well. So as being an employee, so and traditionally OSHA. So those are certificates, we should have them updated.
It would just seem to me that a roster submitted to the director would be the redundancy necessary to see who has passed the course. Because if the question comes in, or if there's an inquiry, the inquiry would go to the director of health.
Yeah.
It would seem to me that she would have the ministerial ability to determine immediate status.
Right, so while the
And
course...
that's fine, Bob.
So I think it would still be that
He,
the course participant would still get their
he
completion
should have a copy
certificate.
of it. I apologize. Go ahead.
Yeah, so I think the
Yeah.
the student taking the course would still get the certificate of completion that they've been submitting to us, but yeah, I'm sure we could easily ask for a roster and that then the establishment owner, or at least in this case Route 30, because they're looking at doing the training on site, be much easier just to submit that roster than individual certificates.
That would be my feeling.
Yep, they have to have a roster of who's taken it, and also Wallace, for his own record-keeping purposes, has to have a roster of the date. So I think that's reasonable.
Yeah, those are things that we can
I
look
can
at
reach out to him.
in the, when we do get the regulations advised. It could even be we ask them to attach an outline of the course that goes with the roster, so there's that backup of what was taught at that course. Okay. I guess moving on to
Do you need
direct,
Do you need to make a motion on that? Or is that fine?
oh, that's right, we didn't do that. So if someone could make a motion on giving, I guess, the director administrative approval to, in lieu of having an apprentice or practitioner come before the board, she can just approve them or waive the requirement to have them come before us if they've taken the Wallace training courses.
I'll make that motion to have the director be able to. I'm not sure how to phrase it. I'll make that motion to waive appearance before the board if someone's taken the Wallace course and the director can okay or certify it. I'll make that motion. I'm not sure how to phrase it right now.
Okay, that was well stated. Someone willing to second the motion?
I'll second the motion.
Okay, so Dr. Bichetti has put forth the motion. Maria Zaroulis has seconded the motion. I'll take it. All those in favor signify by saying aye.
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 And on the phone?
Aye.
Chair votes aye as well, so the motion
Aye.
carries 5-0. Okay. And on the agenda, we have nothing listed for all business or discussion, and we'll move on to direct reports, which I think is more the heart of the meeting tonight.
Right. Thank you, Mr. Chairman. So for the Public Health Excellence Grant, we had 8 nurse applications and 6 inspector applications submitted. We set up 4 interviews for nurses and 3 for inspectors. We're going to set those up for next week. Any questions on that? Okay.
What are the inspector positions for again, Shannon?
This is for the grant that we got, so it's a shared position between Tewksbury, Tewksbury, and Billerica.
Correct. And what do the inspector's duties would be what? I understand the nurse, but the inspector's duties would be what?
So it's just like an additional inspector to do food inspections, housing inspections, general complaints, kind of everything that our inspector, Michelle, does too.
Okay, so we are currently paying a company to do inspections right now, correct? That company that was contracted with 3 months ago?
Yes.
And so they said that they were sufficient inspections for food establishments, but in this grant, is it good for 1 year? So would we be hiring a person for 1 year with this grant, or is it a 3-year grant, or
It's a
this person
3-year.
would go
It's a 3-year grant, and the state believes it's going to be extended further.
Okay, and that includes, is it broken down into inspectors and nurses? Because, is that for just one nurse that goes between the 3 communities?
So the way we worded the resume is more so for Tewksbury and Tewksbury because we both don't have nurses. Billerica has a nurse that's 30 hours, so only if they really needed backup or say she was on vacation, the nurse would be able to help out there as well.
Okay, my question is, would it be more pertinent or more germane to have the nurse, have the funds go to more nursing? Because I thought that from my understanding, when we contracted with that company that's helping Michelle already do food inspections, that they could handle all the inspections we needed to do it. Now we're going to pay for another inspector. Is that for foods when we're already subcontracting with another company? My question is, maybe with all the stuff that's been going on with COVID and the schools, would the money not be better spent for for more nursing? That's just my question, because I thought we had the food inspection stuff covered between Michelle and that company that we contract, because I know we had extensive discussions with that person, and they said they could handle it all.
Right. So that's two different things. The town of Tewksbury is paying for the food inspections for one round of all the establishments. And then Tewksbury is the one that submitted the budget for this grant. So it's more
Okay.
like another supplement. So it extend further than our consultant.
Okay, that's fine. I just needed clarity on it. Okay.
Yeah, so it doesn't cost the town
Thank you.
anything.
And how would they divide their time between the community? 1/3 each community?
We're figuring out the logistics on that still. But the nurse the nurse will be full-time and they would do 20 hours Tewksbury, 20 hours Tewksbury. That's what we're thinking.
Okay. Yeah.
I think the other thing to know, Dr. Bichetti, is that when the town was looking just for a part-time nurse, I think you get 0 applicants. And with advertising for a full-time nurse, even though it was split primarily between 2 communities, you would get at least 8 resumes.
Right.
So there's a lot more interest in getting a full-time, or having a full-time nurse get hired than part-time.
No, and I do understand that, but my question is, where it's only 3 years right now, it's nice. I mean, I've dealt with grants before, and they always tell you it's going to go on forever, perpetuity, but it's not always the case. I understand the full-time, but I'm wondering, does this job, and I know a lot of people apply for full-time for benefits. I'm assuming that this position is just a contract one for full-time, but no benefits, or does it include benefits? Because that would lead me to believe that's why you're getting more full-time applications, when it's kind of a pseudo full-time job. You're working full-time hours, but you don't have the benefits. And I would assume, based on a grant, that we're not talking like Tewksbury is not looking to hire someone as a full-time person, including town benefits and everything. Am I correct on that, or am I wrong?
So the part-time position also had benefits because it was 20 hours. If it was 19 hours, they wouldn't have benefits. But the 40-hour position also does have benefits.
Okay, so the benefits, so do they come from one town? Do they come from 2 towns? I'm just saying, like the way the position is, or is it split? Like the person would be working 20 hours with benefits in Tewksbury and 20 hours with benefits in Tewksbury, or like I said, normally with a grant, the way I've dealt with grants before, the person's not an employee really of the town. I've done similar things in clinics. They're funded under the grant, so that's just what my question was. Because sometimes when you get all these full-time applications and splitting it, there's potential for future problems when the grant runs out, should it runs out, even though they said, as opposed to, maybe hiring people like, either way, at 20 hours, I guess they're going to get benefits no matter what. So that's just my concerns there. Like, when the grant funding runs out, I've seen issues come up in other situations where now the people have been working, and are they for the town, or are they just on the contract done? Get done. But anyway, I'll let you figure that stuff out there. I just want to know a little bit more how it's going to be divided. I thought the nursing might be the nursing aspect would be very beneficial for the communities with for elderly flu shots and all these things. So, okay, thank you.
Well, I think the important thing so residents are aware is that the health department has been without a town nurse for several months now. And now that we're about to come into the fall and flu season, and time for town nurse to normally administer flu shots, having 8 potential applicants for a full-time position definitely puts the town in a much better position than no applicants for a part-time and a workload already upcoming for a town nurse.
Correct. We did receive our
So when we had our
yesterday, too.
when Irvie was our last town nurse, she was doing things on a part-time basis with all the tracing she was doing, and everything was all part-time.
Yes.
She was working more full-time, but she was
Okay.
hired part-time, and all the prior nurses in town have been a part-time position. We've never had a full-time nurse.
Okay, I never knew the exact hours. I knew it was a part-time, but okay. I see.
Okay.
Thank you.
So the next up is the food consultant update. So I reached out to Bridget and her software had crashed, so she wasn't able to give me an exact number for tonight. She was working with IT to get me that information, but she wasn't able to get it for me for tonight. Then the next is COVID numbers for Tewksbury. So I printed out the last 4 weeks of COVID number breakdowns of the charts that I send weekly. So starting with August 20th, there were 27 cases in Tewksbury. August 27th week, there were 36 cases. September 2nd, 55 cases. September 9th, 34 cases. And I pulled for this week, which is 29 cases, but I typically pull on Fridays, so there could be some more cases that aren't in those numbers. And then, so statewide, fully vaccinated individuals, September 9th, so these cases are breakthrough cases, it's 0.53%. And then for September 16th, it was 0.61%.
And I'll just add, the director and I were talking before the meeting, and unfortunately, the state numbers do not distinguish the numbers in terms of case counts of those that have been vaccinated versus those that are unvaccinated, because the theory, like the flu shot, is if you may still get the flu, but it'll be much less severe. We just have the total case counts and unclear as to how many of those were vaccinated. So in theory, they should be getting not the full bore effect of COVID versus those that are unvaccinated.
Right.
Could someone, there's a muffled sound or a shrill muffled sound. Is the speaker on, or did something get turned on or off by accident? I apologize. I vaguely could hear what was being said.
Nope, not at this end. We have a nice quiet building. So we're not hearing any feedback on our end.
And I also wanted to bring up that the senior center is hosting a vaccine clinic, COVID vaccine clinic for ages 12 and up next Friday, September 24th from 10 to 3.
No appointments?
No appointment necessary.
What type of vaccines?
From what I understand, Pfizer and J&J.
It's either a one-shot deal or two.
Anything else on that? Okay. So Olivera update. The keeping of animals permit and piggery permit have been suspended indefinitely, and the animals are to be removed by the end of the day on September 21st. Anything else?
May I ask, who is responsible or will be there to oversee that the animals are removed? Is there anyone, or do we just trust that it'll happen and
Animal control
They'll
really
go.
been kind of monitoring that.
thank you.
You're welcome.
They'll have state oversight as well, I would think, huh?
Hopefully.
Yeah, because the MDR inspector has been working sort of hand in hand with the ACOs for
They'll
this.
have state oversight as well.
Is that all?
Yeah, because I don't think Pamela's going to want to rent a U-Haul trailer and cart them off herself, so. So that's, and I think just for public clarification as well, all this has transpired last week. I think there are communications between the department and town council last Tuesday on the date that we had asked at our prior meeting, that the Oliveras submit a completed management operation plan that had been started back in the fall of 2019. And our town council had heard from a lawyer representing Dennis Oliveira and his sister Tina, and the lawyer informed us that Tina and her husband are the two powers of attorney, and that they're handling the business affairs of Mr. Oliveira. So any dealings that we have moving forward with that property, it's to be done either through this attorney based out of Chelmsford or Miss Tina Pacheco. Did I get that right, Tony? Pacheco,
Pacheco.
okay.
I think the attorney for Pacheco would be opining to town council that they have the due authority to represent Mr. Oliveira and bind the Oliveiras to any decisions that become part and parcel of the process going forward. So specifically, we won't be relying on the powers of attorney, we'll be relying on the opinion of the attorney that they have due authority to bind, coming forward and presenting themselves in front of the board.
Right, because I think the only paperwork that we had gotten that day was a voluminous power of attorney notarized document, but you're right, I don't think there was that
Right.
specific document.
Generally, the attorney opines that due authority is present so that we don't have to read or rely upon a document that's presented.
Right, so even though the director said, I just want to reiterate that it was the attorney and Mr. Pacheco that came back and informed the town that they were going to not argue the suspension of the keeping of animals permit, and we also suspended the piggery permit as well. And that they had also asked for that 60-day suspension so they'd have time to reevaluate operations moving forward and, if necessary, complete the management plan for us to review. And the opportunity is still there for them to, at a future point in time, come back before the board and reapply for a keeping of animals permit, and I guess therefore the piggery permit, but there were no promises made that would be special circumstances for holidays or anything. It's animals to be off.
So for Central Mass Mosquito, they do free spraying of residents' yards from June to September. You can just sign up online to have your yard sprayed. There have been 6 cases of West Nile virus in the state in the areas of Essex and Middlesex County. Some of them have moved to moderate and high risk, but Tewksbury is still at low risk at this time.
Okay, any questions for the director, any of her reports?
I have none.
I couldn't hear a thing. I'm sorry.
We'll have
Came
to
all through
rely on the
babble.
transcripts, Tony.
Under board reports, we have September Emergency Preparedness Month. So even though we're still dealing with the remnants of COVID, I just wanted to take the time to remind residents that September is Emergency Preparedness Month. And as we've had some hurricane near misses, it's just a good reminder that weather patterns are changing and we are getting more severe instances of weather that could reduce in power outages or worse. And now's a good time just to make sure that if you do have an emergency generator, that you make sure you check it's in working order and make sure you always operate those outside and away from windows so carbon dioxide does not enter the house. And I think one of the most basic things, having gone through a 5-day power outage a couple of years ago, is to buy a very inexpensive thermometer, one for the refrigerator, one for the freezer, and keep them in there to make sure that food is at the safe temperature levels, both in the refrigerator and freezer, in case there ever is a power outage. And then the state has plenty of resources and checklists on what to make for an emergency supply kit, besides additional batteries and flashlights and so on. But now as we're trying to get back to more normal life, and whatever that new normal is, it's a good time just to remember that we do have weather events to watch out for. Now we have winter will be on the horizon, so just a good chance to review what your emergency preparedness plans are for your homes and update if needed, and just make sure you have all the supplies handy that you may need.
I do have one more briefing for the board. It's been brought to our attention by the lead school nurse that there are 5 positive JV players on the football team. They're currently going to test them again tomorrow to try to figure out who is eligible for the game on Friday night. We're waiting for guidance from DESE and DPH because there's no more sector-specific guidance at this time, so.
And the game Friday night is at the new stadium too, so it's not a homecoming game, but it's darn close.
Yes.
Not good timing.
No.
Does the Athletic Association chime in on that?
They're aware. However, there's no real strict guidance for sports currently. It's the same guidance as everyone else has been using. Fully vaccinated, don't need to quarantine. And then it's figuring out the close contacts, which is always a little tricky, depending on where they've been, if they were masking in locker rooms and such.
Do we know if any of those positive cases are breakthrough cases?
I'm not sure.
Yeah, I think when the town manager briefed us that they were just looking into that to see how many, if any, were breakthrough and how many on the teams are vaccinated and just get a better idea of where things are. So I think they weren't looking at making a decision until tomorrow.
You said it was the junior varsity?
Yes.
So the younger they are, the less likely they are that they've been vaccinated. Okay.
I guess one thing I just want to bring up, when we had our special meeting August 18th, we had talked about trying to have the board meet more frequently than once a month just to review COVID numbers. And at that point, everyone was just starting to come back from summer vacation, from having traveled either within or outside the state. And numbers had been slowly increasing, and we had looked at trying to potentially meet every other week. We were not able to in that first week, or the first time, so we figured we'd do it this meeting. Given the rate is not increasing exponentially, I don't see a need that we need to meet to review this like every other week. We can just have it as an ongoing item at our monthly meetings, and if things should change, we just address it accordingly. But I don't think there's reason for concern now that dictates that we need to meet more frequently just to review the numbers.
I agree.
I agree with that. The only caveat would be the board has some other pending work that they're trying to catch up on, and some of the bylaws that we're looking to amend, review. So maybe we could keep that bi-monthly thing open, because easily one of those could be turned to a work session. And I would only indicate that that might be a good opportunity to try to squeeze in a work session on some of the things that we're looking to catch up on, including the future keeping of animals permits and tattoo regulations, et cetera.
Yeah, and I think as we're talking about that, and as a follow-up to our August 19th meeting, talking about adopting the state's food safety code, and then amending to it our home regulation of requiring a ServSafe certified person on staff. And that was going to be in conjunction with utilizing labor resources from the grant that the 3 towns have for the inspection of that, to see if we could provide ServSafe training for restaurants or food establishment permit holders in the 3 communities, so that everyone's getting standardized training as part of this rollout. And we need to get this done before really come into the fall, because we're coming into restaurant reinspection time, and you had correctly pointed out that we can't just drop this and have it effective January 1st, but to give it a period of time, and that would then give enough time to hopefully get training lined up so that people can take that training. So my goal would be if we could have some type of a work group meeting between now and our next meeting, which, as long as just 2 board members, we don't need to have it publicly noticed, and then bring that before the board at our next meeting, and then have the public hearing, just get people's opinions on that, and then move forward on that.
I think from a standpoint of putting that together, maybe we'd want to identify a couple of board members that might attend particular work sessions in particular areas. Maybe you could draft something up and make a request to see who's available to chime in on any particular area. Again, avoiding the publication necessity and accomplishing these milestones in a sort of calculated manner.
What the heck that is?
Amazon.
Yeah, I would say at least if either you or I were on these work groups, and at least, because it'd be helpful having at least one of us in both those groups.
Maybe we can take an Outlook calendar and put down the subject matter and put down the members that might want to be present, and we can somehow keep track of that on a schedule, meet, and be able to report to the board on the next meeting. So I hate to put that burden on you, Mr. Chairman, but it seems like it's almost a natural for you.
Yeah. So,
Bridget has been informing the establishments when she's been going out that this is coming, so they are getting somewhat of a warning.
Good.
so I think one thing is to be handy, and I don't know who best to do this, would be to do a bit of due diligence to see what would be required if we were to do serve-safe training. What would that entail, so that we can, to me, that's going to be a key element to whatever we write for this new regulation. And I'm not serve-safe certified yet, so I'm not the best one to chime in on that. So I would look to maybe you, Dr. Bichetti, and you, Mr. Scarano, will you
Dr.
serve-safe?
Bichetti would
Yes,
pro- Dr.
yes, I
Bichetti
hate
would
to
probably-
interrupt. Can anybody hear me? Because everything is coming in garbled, but I did hear something about serve safe. Is there some button or somebody's done something there? The past 20 minutes, 25 minutes, I've heard nothing but garble.
We're signing you up for a project, Tony.
We volunteered you for a lot of things while you were in communication. No, we're just looking at having you and maybe Mr.
Kind of like the Three Stooges. Everybody steps back and the curly's left out front, huh? Yeah.
Why don't we adjourn, or have the motion to adjourn and finalize the schedule that we're putting together, so Tony has a chance to chime in on the ServSafe, because I'm just going to speak for him. He probably has the most valid certificate and newest certificate. I actually have to take the test again. So I need to be recertified because I'm expiring in November.
Okay.
So I think Dr. Bichetti is probably the person that should spearhead, or at least participate in, because I'm going to find myself taking the test again myself.
So, Dr. Bichetti, if you hadn't heard much of this, we'd just like you to sort of spearhead an effort to pull together what you would envision a tri-community serve-safe training course to incorporate, because we need to include that in our, I guess, food safety code regulation.
I'd be glad to help on that, since I do have the, I I believe, the highest level of serve-safe training. So I guess if I wanted to open a restaurant, I'm all set. I would be glad to help, even though the communications and the phone and the car radio and stuff not good. But if it's serve-safe related, I feel I can be of assistance.
Well, we'd assume too, you'd be able to do this in person at some point when you're in town, not by phone. So that'd be at your schedule. Okay. So I think we can do two things sort of in parallel, because the other part is procedurally is to write the framework for adoption, which I can just grab, I think Wilmington has done, and then pass that to you for you to look at. And I think we just take that and whatever Dr. Bichetti brings back, and we're done with that.
I think you're right, and we'd be able to adopt that wholesale.
Yep. Okay. Good. That's a good plan. Okay, anything else from anyone tonight?
The only other thing that I think the September Emergency Preparedness Month seems to be significant rain. So if you have sump pumps and you have flooding basements and you have water issues, it's time to address the downspouts, making sure that the water is going away from your house. The sump pumps, you should test them, and if they're not testing properly, you should replace them, because it seems that water is the common enemy in all of these storms. I'll leave it at that.
No, it's a good point, because we've had a very rainy summer. Okay. Mr. Rue, I believe it is your time.
Mr. Chairman, I'd like to make a motion that we close tonight's meeting.
Okay, so Mr. Rue has put forth the motion to adjourn tonight's meeting. Who'd like the second?
I will second the motion.
Okay,
Thank you very much.
so Mr. Rue is to second the motion. And we've all written down tonight who is first and second in all the motions. And I've stated it too for the record, so we should be set. So the motion's been put forth and second to adjourn tonight's meeting. All those in favor signify by saying aye.
Aye.
Dr. Bichetti? Well, chair votes aye, so motion carries 4-0 and
One abstention.
1 abstention.
Aye.
It is 6:51. Good night, Tewksbury.
Good night.